Welcome back to Eating Well with Diabetes. My name is Phoebe, and I am one of the registered dietitians here at Lompoc Valley Medical Center. I am glad that you are joining me for part 2 of this 4-part video series. In this module, we will be covering the goals of nutrition therapy, benefits of adopting a whole food approach to nutrition, our 3 macronutrients with a spotlight on carbohydrates, our micronutrients, and determining the best choices for overall health. We are going to begin by discussing the goals of nutrition therapy in the context of diabetes. We want to start by promoting and supporting healthful eating patterns to improve A1C, blood pressure, cholesterol, and to prevent diabetes-related complications that we went over in part 1. Then, we want to provide individualized nutrition recommendations based on personal and cultural preferences, access to food, willingness to make changes, and any barriers that you may have, whether that be physical disability, financial constraints, or disordered eating behaviors. We also want to maintain the pleasure of eating with mindfulness practices in place. We will talk more about specific mindfulness practices in part 4. We want to keep in mind that we eat every day, so we should be able to enjoy it. Lastly, we want to provide individual recommendations with practical tools for day-to-day meal planning. Our goal is to make you feel empowered to make informed nutrition choices that set you up for success. The number one recommendation I have for nutritional management of diabetes is to eat primarily whole foods. Whole foods are the foods closest to their natural form. They do not have a ton of ingredients because they themselves are the ingredients. Let's discuss 4 benefits of adopting a whole food approach to nutrition. Whole foods provide a broader spectrum of nutrients compared to processed foods, including vitamins, minerals, fiber, and antioxidants. These nutrients are critical for overall health and helping to regulate blood sugar levels. Another benefit to a whole food approach to nutrition is fiber content. Fiber plays a crucial role in diabetes management because it slows down the digestion and absorption of carbohydrates, which better regulates our overall blood sugars. It promotes feelings of fullness, which aid in better weight management, and is beneficial to our overall digestive health. Our next benefit to adopting a whole food approach to nutrition is the lack of added sugar. The majority of sugar found in whole foods is naturally present and is often accompanied by other beneficial nutrients like vitamins, minerals, fiber, and antioxidants. Excess sugar can lead to spikes in blood sugar and contribute to insulin resistance. Lastly, whole foods help us to have accurate hunger and fullness cues. Feeling satisfied by our food can help stabilize our weight. Foods high in fiber and protein are the most effective tools for satiety. We are now going to look at the opposite of what we just discussed by learning 4 downfalls of ultra-processed foods. Ultra-processed foods usually contain additives, preservatives, and artificial ingredients. These are things like sugary cereals, packaged snacks like chips, crackers, or granola bars, fast food, sugar-sweetened beverages, candy, and processed meats. High added sugar can lead to rapid spikes in blood sugar levels, as well as rapid drops in blood sugar, which may leave you craving more sugar. Excessive sodium can raise blood pressure levels, especially if there is no dietary potassium present. It is important to note that salt is not inherently bad, but when it is consumed in a diet high in sugar and lacking fiber and micronutrients, we can create more problems than our body wants to handle. A poor macronutrient profile means that the ultra-processed food is low in essential vitamins, minerals, and antioxidants. It is hard to adequately obtain all of our micronutrients through processed food alone. Lastly, ultra-processed foods are hyperpalatable, meaning that they often add substances that enhance the taste and prolong the shelf life. This can lead to struggling to recognize accurate hunger and fullness signals. Hyperpalatable food makes companies a lot of money because they design their food to be hard to resist. Even though our number one nutrition management tip is eating whole foods, we can always make room for all foods in the diet. These foods can absolutely exist in a healthy intake, but we want them to be the exception, not the rule. We will now move on to introducing our macronutrients. Our food groups are made up of macronutrients. They use the prefix macro because they are needed in larger quantities in the body. Vitamins and minerals make up our food as well, but they are micronutrients, meaning we need less of them to survive, but they are still important to overall health. Our three main macronutrients are carbohydrates, proteins, and fats. Some examples of protein include beef, lamb, chicken, turkey, eggs, Greek yogurt, fish, seafood, venison, bone broth, and tofu. Some fat examples are avocado oil, olive oil, coconut oil, butter, and avocados. And finally, the examples of carbohydrates include fruits, potato, sweet potato, honey, bread, rice, squash, oats, pastas, beans, and lentils. It is difficult to put food into precise categories because a lot of foods have multiple macronutrients present. Let's go through some of the examples of combinations of macronutrients. Our first combination of macronutrients is protein and carbohydrates. These foods are things like quinoa, beans, lentils, and fat-free dairy. Both proteins and fats can be found in bacon, sausage, eggs, oily fish, and nuts or nut butters. Lastly, the macronutrients carbohydrates and fat make up foods like ice cream, cake, cookies, french fries, granola, and avocado. Now that we have covered fats, proteins, and combinations of macronutrients, let's spend a few minutes talking about carbohydrates, our number one nutrient of concern in regards to diabetes. Carbohydrates is the number one energy source for the body and brain. Carbohydrates convert into glucose in the body, which gives us the energy to function optimally. Diabetes does not mean that we cut carbohydrates out completely. Carbohydrates are the body's preferred energy source with or without diabetes. Our focus should be less on if we should or should not eat them, and more on how we can eat them in a way that gives our body consistent energy without causing spikes in our blood sugar. Our most common carbohydrate sources include bread, rice, potatoes, oats, fruit, pasta, cereal, and tortillas. Carbohydrates can be separated into three categories: sugar, starch, and fiber. Sugar is found in candy, soda, juice, cookies, fruit, and dairy. Starch is found in bread, pasta, rice, oats, and starchy vegetables like corn and peas. Fiber is found in beans, legumes, fruits, and vegetables. Sugar is found in two forms, natural and added. The types of sugar typically end in the suffix "-ose", like fructose and sucrose. Sugar can cause a quick spike in blood glucose because it is easily digested by the body. Our bodies typically respond differently to natural sugars because they are accompanied by things like protein and fiber, which help slow down the rate at which the sugar absorbs in the body overall. You may not always see the word sugar on an ingredient list. Sugar may be identified as the following: agave, honey, molasses, lactose, syrup, caramel, dextrose, fructose, glucose, maltose, sucrose, maltodextrin, and corn syrup. Many people move to sugar alternatives when diagnosed with diabetes. Think beverages like Diet Coke or zero sugar Gatorade. Sugar alternatives give you a sweet taste without the blood sugar spike, typically having less calories as well. Our main type of sugar alternatives are sugar alcohols, artificial sweeteners, and natural intense sweeteners. There is a lot of debate surrounding if sugar alternatives are safe. There is no research to indicate that the use of sugar alternatives is not safe. In some people, sugar alcohols may cause a laxative effect in excess, but that's all we know. Sugar alternatives are a great option, especially if you prefer sweet foods or beverages. Starch causes a slower spike in blood sugar in comparison to normal sugar. The digestion time of starch depends on the fiber content. This is why we promote the intake of whole grains and starchy vegetables, because they typically have more fiber. Some examples of grains are bread, rice, oats, cereals, and pastas. Some starchy vegetables are foods like potatoes, corn, peas, legumes, and squash. Fiber itself is not digested. Good bacteria in our gut may feed on the fiber depending on the type, which is why fiber is important for gut health. Fiber slows the absorptions of carbohydrates in our gut better than sugar or starch. Foods high in fiber include whole grains, beans, legumes, fruits, and vegetables. Most of these foods may contain starch or sugar as well. We cannot stress the importance of a high fiber diet enough. Fiber helps to maintain bowel health, lower cholesterol, control blood sugar, and stabilize your weight overall. In order to get the most out of our carbohydrate consumption, follow these 3 tips. Choose fiber-containing carbohydrates. Pair your carbohydrates with a protein and fat, like apples, your carbohydrate, and peanut butter, your fat, and be aware of portion sizes. We will deep dive into portion sizes more in part 3. Again, the best choices for overall health are high fiber, nutrient-dense carbohydrates like vegetables, fruits, legumes, and whole grains. These foods allow our body to work the most optimally, leading to a happier and healthier life overall. Let's move on to some of our other macronutrients. Fats are very important to overall health because they aid in vitamin absorption, specifically for vitamins A, E, D, and K. They provide structure to the cells. They create protection for the cells both physically and through antioxidant properties. They aid in the production and signaling of hormones and act as an energy source for the body. The type of fats we choose to eat matter. We want to select fat sources that help to manage cholesterol and triglyceride levels. Here we have a red, yellow, and green light system to help us identify which fat sources we should integrate into our usual intake. We want to integrate fat sources like olive oil, avocado oil, coconut oil, avocado, nuts, oily fish, and full-fat dairy. Butter and cream are great to eat in moderation, but done in excess, they can have negative effects on the body. We want to limit foods with hydrogenated oils like margarine and high-fat processed foods like cakes and cookies. We will finish up our macronutrient section with protein. Consumption of protein leads to longevity because it helps with preservation of muscle mass as we age, which helps you stay healthy and capable in the later years. Protein builds and repairs tissue, makes up enzymes and hormones, and they're the building blocks for bones, muscles, cartilage, skin, and blood, as well as your hair and your nails. Let's go back to our red, yellow, and green light process in order to determine what proteins we should be integrating into our usual intake. We want to eat most fish, seafood, chicken, turkey, lean beef, eggs, Greek yogurt, and beans. We want to have a moderate amount of high-fat meats like ribeye and pork, along with high-fat ground beef. We want to limit any processed meats including salami, ham, bacon, and sausage. Let's move on to micronutrients. Micronutrients are heavily involved in keeping blood sugar levels normal. They are small, hence the prefix micro, but they essentially make the body perform all functions properly. We cannot properly utilize our macronutrients without adequate micronutrients. We could talk forever about all the micronutrients that are involved in blood sugar management, but we'd be here for a long time. So today we're just going to focus on the major players. Minerals are inorganic substances. You may recognize these from the periodic table. Small amounts of these minerals are found in the foods that we consume. Calcium helps the body more effectively release insulin. Eating enough calcium has been shown to keep blood sugars more stabilized. Chromium helps the cells better accept insulin, while zinc helps with the processing, storage, secretion, and action of insulin. Adequate iron is vital to living a healthy life, including when we think about our body's ability to lower the amount of glucose in the blood. Magnesium assists with the glucose's ability to enter cells, therefore lowering blood sugar. And finally, potassium may influence insulin secretion and cells' ability to accept glucose. There are a lot of different ways that these micronutrients are involved in diabetes. Does this mean that we want you to supplement all of these? No, actually we wouldn't recommend it. Instead, we recommend getting all of these nutrients from whole food sources. If you get a wide variety of foods, you'll likely get all the micronutrients that you need. The only exception might be magnesium. It is common to be low in magnesium due to the high-stress world that we currently live in. For supplementation, we want to look at magnesium glycinate, and we want to talk to our dietitian or doctor before we choose to take magnesium. Vitamins are made up of organic compounds that are essential for proper human functioning. Like minerals, vitamins are found in small amounts in our food and keep our body running properly. Think of them as the spark plugs to the metabolism. B vitamins help with the proper digestion of carbohydrates. Vitamin D helps with insulin being released and recognized by cells. Vitamin C and vitamin E reduce oxidative stress and inflammation throughout the body, therefore helping the body's ability to be able to recognize insulin. People come into my office asking me to tell them exactly what to eat or if there's a certain diet pattern they need to be following 100% of the time. I can present all the research in the world on what foods may be best to consume, but it is still not as important as your own personal experience. We all have individual needs that are imperative to honor, like cultural tradition, health goals, price points, preferences, our family systems, and more. One size does not fit all. When working with a professional, we want to look at things from all angles, starting with the professional's clinical expertise and experiences, looking at what the research has to say, identifying the patient preferences and actions, and then collaborating to establish shared decision making regarding what is best for you in your life. You have reached the end of Part 2, Nutrition Basics. Next up, we are going to introduce the nutrition label, the plate method, and portioning. Thank you for tuning in to Part 2, and I will see you in Part 3.